Hi, and welcome. This is Dr. Dan Purser, danpursermd.com. I'm the guy who brings you medical magic tidbits and other Western and natural medical ideas. You're going to mix them all together and get to the root cause of your problem. You can go to danpursermd.com or email us to book an appointment time or call us at 801-796-7667. We have books on Amazon or Kindle in paperback or on e-version in Kindle. Kindle, did I say Kindle? Kindle, all under Dan Purser MD. I think I've had 17 number one books on Amazon, some many overall. If you read one and liked it or hated it even, please leave a review. I need nice, honest, or even a scathing review. Check out our YouTube channel. Check out our podcasts. Where I ask you this every week, where are podcasts?
Everywhere where podcasts are. Apple Podcasts and Spotify.
So, but I asked you before, not at Walmart, not at CVS.
Uh-huh.
You can't go in there and download. You got to go to Spotify or Apple.
On the apps. Yep.
On the apps. Okay. There's all kinds of podcast apps.
Mm-hmm. But most people just use Spotify or Apple Podcasts.
Yeah, that's the one I use. You can also check out my website, danpursermd.com, or our supplement website at physiciandesign.com or on Amazon. We're starting to get everything back up and going again on Amazon.
Little by little.
And if you like me, like what I've done or like what I've said or just like listening to my voice, please leave me a nice short 12-page review on Google extolling all my virtues. Okay. Jackson, any word on what product next being built out? So we have Copper Balance.
Yep, Copper Balance is back in stock. We've been selling it all week, basically, or at least the last couple of days. Head over to physiciandesign.com. It should be back on Amazon very soon as well. And then the next one we're working on is getting the MTHFR Support Plus back, but the new updated version.
It's called Endure.
Mm-hmm.
Maybe.
Yep, MTHFR Endure.
So we're really going to do a lot more with our Amazon pages too, right? That's the word.
That's the plan.
That's the thought. Okay. So, Brecken, who are the three prize winners from last week?
We've got Doe Holland McCammon.
Say that again.
Doe Holland McCammon. Jasmine Bonin Hoychik. Rachel Hassard Shepard. Sorry, all of them have 3 names. But I've DM'd all of them, so if you guys know them, let them know to check their DMs that they won the prize from last week's Facebook Live on IC, right?
Tell me their names again.
Okay.
So, Doe Holland McCammon.
Yeah, McCammon.
Jasmine Bonin Hoychik. Rachel Hazard Shepard.
Yep.
Hassard.
Yeah.
Okay, Rachel Hassard Shepard. Got it.
Look in your DMs.
So they get a bottle of Copper Balance and our bottle of Rivars glutathione?
Yes. Yep.
Well, they're going to have fun with that.
Mm-hmm.
They'll be up all night. I hope they really like those gifts. So if you need a physician who likes to listen to you, who honors you, respects your opinion and knowledge, who will look for root causes, who digs really deep if you want me to, who's hardly ever late, and will apologize profusely if I am, and understands essential oils and other natural options first, connect with me and I can help you with all that. I historically have a lot of patients that fly in or drive in to see me, and then they can be my patient. They have to come back in when I have to do a physical follow-up with them, but that's pretty easily arranged. So if you want to become my patient, I keep forgetting to say all this, I can still see you as a patient through telemed, but only as long as you fly in to see me in Utah, where I'm licensed, when the restriction laws live. If you have questions about this and all the timing involved and stuff, call my office and we'll address this for you, or email us and we'll address it. To my left is Brecken. She's my stepdaughter, lovely assistant, and co-commentator. And behind the camera and audio is my equally charming stepson, Jackson, who runs some of our businesses.
Mm-hmm.
Really, most of them. Because we get too busy with everything else to run them. They also both help work in our companies and help us give you the products you need, with the benefits you can rapidly fill. So, famous medical quote of the week. So this is the one from last week. Let food be thy medicine and medicine be thy food. Who said that, Brecken?
Hippocrates.
Got it right. Now this week, also by Hippocrates, the life's so short, the craft so long to learn, and I know so little. Okay, I added the last part.
Is that really what you want to be known for? You know so little?
I'd say I have other quotes for I'd rather be known for. Can I say them?
Sure.
I wrote them down, of course, so because otherwise I would never remember the quotes. Do not let an insurance company determine your path of care. Quote number 1. Quote number 2. I'm still waiting to hear from Stockholm on this and the Nobel Prize for Medicine. Copper metallothionein dysfunction causes fibromyalgia and some migraines. A lot of migraines, actually. So, antioxidants do work when handled correctly. That's number 3. We're going to find out more and more about this over the next few years. Okay, and one of my favorites, dig deeper, doctors. Try finding the actual root cause before turning to prescriptions. So true.
Yeah.
Okay, last week we discussed interstitial cystitis, or IC, and what I personally believe are the natural causes of that horrible disease. If there are any follow-up questions post that visit, if there are any follow-up questions, post those now so we can look at them too. I'll try and answer them. This week we're discussing progesterone and all its many benefits. So why don't we get ready and you can start asking me questions and I'll try to answer all the questions or get humiliated trying.
Whoever can stump him wins.
What? No. What? No.
I'm just kidding.
I can probably be stumped in like 2 minutes. Okay. So let's start. You have a shot at me. Here it goes. Remember my book on progesterone was #1 3 times overall on Amazon.
Yeah.
Okay.
Pretty crazy. First off, how was your 4th of July?
Hot.
That's it?
Fun. No, it's great. The fireworks going off. We watched from our back porch. Jared, who's getting ready to go off to medical school, he'll be in Clearwater, by the way. If there's anyone out there who wants to say hi to Jared sometime, or make him some cookies, or
He would like that, huh?
yeah, let me know and I'll personally give you his address so you can deliver the cookies.
Oh.
Okay.
I can personally give you Dr. Purser's address
No,
to
no,
give
no,
him
we're not
cookies.
doing that. No. Okay, so that was the wait. That wasn't a
You
question.
want
Go
some
ahead
good
now.
questions? Okay.
Yeah.
When you say natural progesterone, what does that mean and why is it important?
Natural progesterone means it's bioidentical. It's biologically identical. I know that's such an overused term, but it's biologically identical to what your body produces. Plus, it's from natural sources, and natural things were used to convert the soy, which we use the Mexican wild yam, so not soy, but we use the Mexican wild yam to convert the Mexican wild yam to progesterone. So it's as natural as you can get. At least that's our attempt with everything. We're really careful about our sources and what we use and do all that. Natural progesterone, the reason that's important because it has really pretty much no downside. So it doesn't cause cancer. It's never been associated with causing cancer. It actually dramatically reduces your risk for breast cancer. In all cancers overall, if your level stays really good, it does a lot of really incredible things for you as women, and we're going to go through those tonight. And that's it. You want to use the natural form of it.
Yeah.
Bioidentical is the main point.
I don't know about that. That's such a byword. People have overused it, so it started to have no meaning. Actually, a bad meaning, especially among living people. But it just means it's biologically identical to what you make. There's no difference, and we use an all-natural form of it to make everything we play with. So,
Gotcha.
or the pharmacies we use to.
Yeah. I'd say we just started this, but the question I keep seeing pop up is, because Progestins Plus is out of stock right now, what can they be doing instead currently while it's out of stock?
Contact our office. We'll connect you with another option you can use while Progestins Plus is out of stock. It shouldn't be out of stock much longer.
No,
Maybe
it
another
shouldn't.
day or two.
Well, we'll see.
Okay.
Okay. So
Yeah, but you can always contact our office. Email us at info@danpurser, MD.com and we'll help you just for some temporary options.
Cool. So what's the difference between like the Progesterone Plus and like an RDT progesterone option?
One's a medicine, one's just a cosmetic supplement.
And who needs like the different versions? What are they for?
I'm not gonna compare those two. It's
Okay.
not fair, and it could be FDA, FTC violations up there. That just doesn't work as a good comparison. So, I will use the prescription progesterone, like an RDT, for women who supplement help or helping them get their ovaries going better or whatever we do to address that. And that's often what we try to do. But when they need a lot more than just what a little supplement can provide.
Yeah.
So when some women just need a lot more, they're having severe hot flashes or night sweats or severe PMS or severe endometriosis. Endometriosis is probably one of the most common bad low progesterone things I see. You give them a lot of natural progesterone, and 99% of women feel really good on it or more. So, and there's no real downside to the upside of high dose progesterone.
Yeah.
Except for it will make you drowsy. It will. That's called a progesterone hangover. You don't want that. That means you're taking too much.
Yeah. It's hard in the morning. Not fun. I've done that. Is there any age that women should stop taking progesterone, or is there any age that's too young for progesterone?
Yeah, if they're not menstruating, then they probably shouldn't use it. But some girls start a pseudo menstruation before they really have their first period, and maybe a little support with something like PP would help a little there maybe. I know I do not personally believe there's an age where they should stop taking it. Doctors will say that you no longer have ovaries, you no longer have a uterus, you don't need it, but you're still a woman. You still need it. It helps you sleep. It helps reduce your risk for various cancers. It helps prevent osteoporosis. It does a lot of good things. Natural progesterone will.
Yeah. So even if you've had a hysterectomy, you definitely should still be taking it, right?
I don't know about definitely, but I believe you should. Most doctors probably argue with that.
Yeah.
That's fine. They're entitled to their opinion. I've got the book and the references and everything to back me. So
Yeah. Did you mention that progesterone helps with endometriosis?
yes,
So what does it do for that?
cools everything off. Women who have endometriosis, I know I'm going to get a lot of blowback on this. My belief is they're not making enough natural progesterone internally in their ovaries, and so they need extra. Proof is in the pudding. Ask questions to the women who are on this Facebook Live tonight, and some will pop up and say, yeah, they take the progesterone for their endo, and they feel really good doing it. It's like your mom. She took it, so.
Yeah. So you mentioned earlier that progesterone helps prevent cancers, whereas a lot of literature nowadays, sometimes they're saying that it could cause cancer. Why do you believe that it does?
They conflate natural progesterone with the synthetic progestational agents all the time. Physicians do write those articles, researchers, that they're wrong. And that's been proven over and over and over again. It's inarguable. First study that really touted it, natural progesterone, was 1981. The American College of Epidemiology. Was it epidemiology? I believe so. I've got the article in my breast cancer patient survival guide, and also in my newest edition of my progesterone book on Kindle and Amazon. But it's where they showed if you have a normal level of progesterone, you'll have a 500+% decreased risk of breast cancer and 1,000% decreased risk of all cancers overall.
Man.
And that's continued to be shown again and again. While the synthetic progestational agents, as in birth control pills and other things, have a 250% increase minimum in breast cancer risk. That's why they always put those package inserts in the pills.
It's scary, yeah. What about if you're pregnant, should you be taking progesterone?
Some women miscarry often, so OBGYNs will prescribe them progesterone, or women with bad endometriosis or can't mount a proper progesterone response because they have vitamin deficiency or whatever. That's partially my job to figure that out. I get a lot of IVF failures, I call them, or people who can't afford to pay for IVF that want to look at other options first, which is wise to try and do that. But they need progesterone at least through the 10th week, when they're hopefully by then they're mounting a really big progesterone response, because your progesterone level normally is above 10, maybe 20 before you're pregnant, or when you first get pregnant. And on the last day of pregnancy, it can be as high as 900, and so you might need a lot of progesterone to maintain it through. I have a few patients who, instead of wanting getting the progesterone shots from their OBGYN, will just keep taking the RDTs throughout their pregnancy.
Yeah.
So yeah, it happens.
Yeah. Do you think that progesterone can help with like depression and anxiety and those kind of
Definitely anxiety. It helps a lot of women with anxiety. It's very calming. It's very nurturing. It's a feel-good hormone, as we called in our book. Title of my book, Progesterone, Women's Feel-Good Hormone. Get it now.
Can you take progesterone throughout the whole month, or is there certain times like during your cycle you should take it? Or
I'm not a big fan of cycling, though some younger patients I will cycle. Most that I deal with have bad disease issues like PCOS, like endometriosis, like severe PMS. Severe PMS, they can probably get away with taking it around the time of their cycle, but a lot of other women like taking it all the time, and I kind of help them work through that and take it how they want or need, because everyone's different. Everyone has such different medical needs, and they're genetically different and have different receptor problems and everything else.
Mm-hmm.
So it's really complex.
And would you say most of the time you recommend taking it at night, just in case of like
Yes. Take it at night, because it'll make you really sleepy if you take it right. Though I'll also suggest smaller doses during the day, especially during that time of the month.
Yeah. Can using progesterone make you more prone to developing type 2 diabetes?
No. No, there's no articles. There's no studies that I've seen that supports that. No. I looked that up.
Not one, yeah. Is there a certain vitamin deficiency that you commonly see with women with low progesterone levels?
Yes. B12, folate, pantothenate.
So it's
probably the top three.
like MTHFR patients probably more commonly.
A lot of them have low progesterone. They have low hormones. They have ovarian insufficiency and a lot of other hormonal problems. Thyroid. They'll appear to be hypothyroid. Their ovaries aren't working correctly because they're so deficient. Because those genetic errors block your ability to absorb B vitamins and certain other things at a cellular level. Again, I'm going to say it. Good nutrition in, good vitamins in equals good hormones out.
Yeah.
Like progesterone.
What about those with estrogen dominance? Should they take progesterone?
Well, I don't know. It's case by case, but usually the way you balance out estrogen dominance is by taking progesterone to balance it out. You don't bring down the estradiol level. Though I know I've talked to some women who are like, they want to remove one of my ovaries or do a hysterectomy on me to bring down my estrogen dominance. I need better answers than that to make that decision. I wouldn't do it.
Yeah. Can you take progesterone after having an ablation? I don't know. What is an ablation?
So some women for endometriosis get laser ablated. They open them up, surgically, and zap all the little inflamed areas on their uterus, or inside their uterus, inside their cervix endometrium, and they're trying to keep them from having crazy heavy periods, so they scar them up in there. It doesn't take away the need for adequate amounts of progesterone, even if you're 35 or 32 or 41 or 50.
Yeah.
Just because you've had an ablation, it doesn't really deal with the root cause. And maybe taking progesterone does not deal with the root cause. I try and usually find out what the root cause is and deal with that. It's a little more difficult to do that, but it's usually the cheapest way to go. Which would you rather do? Take expensive progesterone RDTs the rest of your life, or take vitamins that'll help you build your own progesterone in your ovaries?
Yeah.
I'd take the
Definitely
vitamins.
the natural option too.
Yeah.
What about this lady? She had breast cancer 20 years ago. 2 lumps tested positive for estrogen and progesterone. Suspected from HRTs, but she's wondering, is it okay to use progesterone now?
So this is what I was told at USC by the PharmDs there, because I was telling patients not to take progesterone when they had breast cancer. They said that was a big mistake. That, again, I'm going to reiterate, progesterone's never been shown to cause breast cancer. Never, ever, ever. No study. What it does show, you can go to PubMed and search progesterone and the word apoptosis, APOPTOSIS. There are literally hundreds of studies that show that progesterone kills breast cancer. So pops it, or it causes apoptosis of breast cancer cells. Over and over and over again, they keep finding the same data in those studies. Natural progesterone, not synthetic, not what's in birth control pills, because it does not pop breast cancer cells. It's very inflammatory and pro-inflammatory and causes breast cancer, or is at least heavily associated. I'm talking about like norgestrol and stuff like that. Having progesterone receptor positive cancer is actually advantageous to take more progesterone because it attaches to and causes apoptosis of any pre-malignant cells. That's when women who take natural progesterone get really tender breasts, because it's essentially eliminating the fibrodense breast tissue, which is full of pre-malignant, precursor breast cancer cells. I don't know if most women out there know that, but it is a breast cancer risk factor to have fibrodense breast tissue, because a lot of that tissue is precancerous, and progesterone kills it. So, and it does the same with preliminary early breast cancer cells. Will it cure breast cancer? Probably not once it gets set in and active, but at least it reduces your risk dramatically.
Yeah.
Of all cancers. And so also know this, there's no cause and effect with progesterone and breast cancer. Just because you happen to have progesterone receptors on a breast cancer, that's not the progesterone. Progesterone didn't cause that. It's just your genetic error that caused that cancer that caused it. No cause and effect between the progesterone and the breast cancer.
Crazy.
Does that make sense?
Yeah.
Mm-hmm.
Yeah, people are always like, it caused my breast cancer. No, it doesn't. There's been no studies to show that.
Yeah.
Just so you know, I lectured to physicians all over the world about this stuff. And clearly not in the last 6 months, but yeah, five times I should have spoken in Orlando so far this year, and maybe 4, I can't remember, but they've all been canceled, but some of them were about progesterone.
Yeah, it's true.
2 physicians, practicing MDs. So I've never been sued for my book. I've never had anyone question it. The references are really solid. So
That's why it's been number 1 so many times.
Yep.
Just kidding. What kind of testing do you recommend women get for hormones, or like you mentioned, vitamin testing?
It varies so much according to where you are, what you've been doing, what time in your life you are. I usually like, if you're just postmenopausal or just getting there and not quite sure you're there, I'd want to see a progesterone level, an estradiol level, a TSH, an FT3 and an FT4, and a free and total testosterone, and a DHEA SO4.
Is the drop in progesterone after pregnancy the reason why so many women go through postpartum depression, do you think?
Has a lot to do with it. You want to make a woman happy or less depressed after having a baby, and if they have postpartum depression, give them some, some Progestin Plus or some good vitamins or something.
Yeah.
Probably PP is what I'd give them.
Can progesterone help with hypothyroidism? You kind of mentioned that
No.
earlier. No? Do you think they're connected at all?
No. No, both can be due to vitamin deficiencies, but they're not really directly connected.
Gotcha. Is there a certain area that's better to apply progesterone? I know some people take it orally.
Oral is the best. The creams haven't been shown to work. There are a couple of serums that work, but they're still not prescription level by any means. Yeah. So wrists, behind the knees, stuff like that. So when I said the creams have not been shown to work, after 30 days, the cream is 30% less effective. After 90 days, there's nothing in that cream, no progesterone left that's functional.
Yeah.
And that cream, it oxidizes, it goes bad. There's been several studies now that have shown that.
Yeah.
So everyone's moving away from creams, or should be.
Yeah.
Progesterone cream just doesn't work very well. And some women are not a good absorber. I'm not a good absorber of testosterone cream. You can literally, I can fill a bathtub with it, roll in it all day like a pig in mud, and it would do nothing for my testosterone level. I'd look really funny and feel horrible.
Would you
but
turn like yellow or something?
probably, who knows? Slimy. Ugh.
Could you take progesterone while also using birth control?
I usually advise not to, because I don't want to be blamed if they get a clot or anything else, which is fairly common with birth control pills. But I don't know about fairly common, but a certain percentage of women are going to get clots, strokes, heart attacks from birth control pills. And I just don't ever want to be blamed for it.
Yeah.
But it's safe to do. You can take them together. It's not going to cause an increased inflammation or anything like that. To wean some women off birth control pills for their endometriosis, I will give the two together for a month or two till they get off the birth control pills.
Are there any signs that your progesterone level is too high? Like if you're taking too much?
Yes, you get sleepy all the time. It's called a progesterone hangover. If you take too many RD, rapid dissolved triturates, which is my favorite form, or progesterone capsules at night before bed, and you have a hangover the next morning, I always say, if you're waking up at about the time that Price is Right is coming on, then you probably took too much. Because that's usually around 10 or 11 o'clock in most parts of the country.
Yeah.
Not good.
What about those who have factor V Leiden, the blood disorder? Can they take progesterone?
Yes.
Cool.
I know their doctors won't give it. They'll fight them on it, everything else. It's the estradiol you can't take.
Is clary sage a good alternative to progesterone?
No.
What is clary sage for?
It's been a natural alternative to estradiol for
Gotcha.
hundreds of years.
Gotcha.
Estrogen.
What about, can progesterone help with hair loss?
Yes. I remember I was speaking in, I want to say St. Louis, and at a big event, and a woman got up because I said, does anyone want to speak to the virtues of taking natural progesterone? And this lady got up, and she was hilarious. She just went through the list right down the line, said her hair was thick and pretty and bushy now, where she'd been losing it before, all this. Yeah, it can definitely help. Not just from that, but there's lots of studies that show that.
Yeah.
But the number one cause of women's hair loss is vitamin deficiency. There's a great book called The Bald Truth About Women's Hair Loss by Spencer David Coburn. And let me summarize it for you. And they're really hard. For a while there, they're really hard to find copies. They were going for $300 plus each on Amazon used, but he finally put it back in print. But I'm going to summarize it. Vitamin deficiency is by far and away the most common cause of women's hair loss. If you know someone who's lost a lot of hair or has a lot of hair loss, it's almost always a vitamin deficiency. And if they can't get help anywhere, have them contact my office.
Yeah. Are there any medications that counteract progesterone or that you shouldn't take with progesterone, like thyroid medication or diabetes?
No.
Nope, nothing.
It's natural.
Yeah.
Real quick, some people are a little confused because you're jumping back and forth between
Sorry.
Progestins Plus and natural progesterone.
I'm mostly talking about natural progesterone.
Mm-hmm.
I'm really being careful. I don't want to drag Progestins Plus too much into this because FTC, FDA, they can be watching. Who knows? And I don't want to get you living in trouble. So don't be confused. I'm covering the topics.
Progesterone straight across the board,
Hmm.
right?
Yeah, and you can apply that to whatever you want. Okay.
Sorry, I'm scrolling through all these. You guys are going so
Because I
fast.
don't want to cause my favorite company to get questions raised or problems.
Yep.
Yeah. So, are heavy periods at 45-year-olds normal with big clots? Is this menopause or is this just low
Could be
progesterone?
perimenopause. Yeah, low progesterone. Start of early start of menopause. The average female goes through menopause at 52 here in the U.S.
Man.
51, 52.
So you mentioned progesterone. It causes sleepiness, but could it help you sleep a lot?
Oh
of the
yeah,
time?
yeah, yes, yeah. A lot of women love the way it helps them sleep. It's incredible. You can't take a little tiny baby dose. You need to take a real dose of it.
Yeah,
You'll know.
you'll feel it.
Oh yeah. Does it help you sleep?
If I don't take it, I have such a hard time going to sleep.
Yeah. So no, don't give it to your husband when he can't sleep. He just gets to sit there and watch you snore like a grizzly bear in hibernation because progesterone causes inflammation in men.
Not good.
So yeah, it's not good. Also reduces libido on men. So
What can you say? What vitamin deficiencies you normally see progesterone?
wait, I did that earlier.
I know, but a lot of people are like, "Oh no, what were they again?"
B12, folate, natural folate, and pantothenate, because most of it's associated with methylation or MTHFR issues. So 85% of young living distributors, from what we could tell when we designed Master Formula and helped design it, have MTHFR or other methylation problems that are significant, because most of them had B12, folate, pantothenate deficiencies. We took 1,000 spectra cells on young living distributors, random spectra cells, and they weren't on any specific vitamins, or maybe they were on something. It was before Master Formula or the new Super B reformulation that I also assisted in. But yeah, we know you young living distributors. A lot of you have methylation problems. That's why you're young living distributors, because you can't take most medications. Birth control pills will flip you out. Prenatals are terrible for you. They cause you nausea and vomiting, toxicity issues, stuff like that. We know who you are.
Yeah. How do you know if you need progesterone without a blood test? Is there a way?
Are you hot flashing, night sweating, PMSing like crazy, have bad endometriosis? I'd still probably get the blood test, but it's not critical to before you start it.
Yeah.
Or I'd probably get it before you start just to see. I like to document it, but yeah. If you're on a deserted island, I'd take it.
Can you take progesterone when you're breastfeeding?
Yes.
What do you think about the Troche progesterone?
It's all right. Trochee's the next best thing to RDT. A really well-made RDT, which is super smooth, tastes great, dissolves quickly, is really hard to find. You got to be really good at the art of compounding. And I know only 3 or 4 pharmacies that can do that in the U.S. really well. And there are probably more. I just know of only 3 or 4, and they're really big ones. But man, they're really good. Much better than a Troche.
Troche, sorry.
Well, it's all right.
I think I called it a Troche.
Yeah, it's all right. It's pronounced all kinds of ways, but
Yeah.
it's a Troche.
Is estradiol progesterone? I've seen that a couple times.
Was estradiol, progesterone,
Yeah,
what?
I just think people are confused
The hormones.
on the difference.
No, estradiol is supports your bones, your heart, your skin. It's what makes you a woman, but progesterone does too. They're both really for women only, and they're just different in so many ways. Estradiol will worsen endometriosis, will cause heavier periods, all that. If you have estrogen dominance, as they say, progesterone backs all that off and gives you light periods, makes you feel really good, and helps you sleep really good, and is a mood elevator the next day.
Do you think that extended nursing causes progesterone levels to drop, or do you think that's kind of just a postpartum effect?
Case by case thing. No, I don't think necessarily.
Yeah.
No.
So the people are also saying Master Formula is out. Do you have any recommendations for?
Email our office and we'll tell you.
How do we contact our office?
info@danpursermd.com. Email them.
Or there's a good contact page on danpursermd.com if that's easier. Either way.
Thanks, Jackson.
Mm-hmm.
Yeah. So yeah, email us and we'll get back to you quick.
If you're homozygous for MTHFR, will you need more progesterone than others?
You need more vitamins than others. You might need more progesterone if you're not getting adequate vitamins. Again, proper nutrition, proper vitamins in equals good hormones out. So you cannot build hormones, testosterone, progesterone, estradiol, thyroid, DHEA, any of them, if you're malnourished, if you have vitamin deficiencies. Your body's in survival mode. You're exhausted all the time. You're tired. You got brain fog, all that. That's not from lack of progesterone. That's from lack of vitamins. Mm-hmm. That's why we fall back on the SpectraCell, because it defines what intracellular vitamin, minerals, amino acid deficiencies you're dealing with. Because serum levels can be falsified from, okay, what if you have a lot of cyanocobalamin, which is B12 made with cyanide floating around in your bloodstream, and your doctor gets a B12 level is going to go, you have a really high B12 level. Yeah, because you can't absorb cyanocobalamin into your cells. If you have MTHFR, it's not going to happen, or certain other conditions, it's not going to happen. And yet you'll have a horrible B12 deficiency on an intracellular evaluation with the SpectraCell. They're the only ones with the technology. Trust me, they are it. They have the patent. They're the only ones. No one quite knows exactly how they do it. It's an expensive process to get into. But I'll show you what deficiency you actually have.
That's great.
I see a lot of people asking about what vitamins to help to, or what vitamins to take to help with their hormones. And I'm sure you want to expound a little bit on that.
Yeah, Super B or Master Formula or Thorne Research has a basic 2-a-day, which is really good. If you're not a Young Living distributor, they also have a Thorne Research B complex, stuff like that. But know your genetics first.
So how can they do that? How can they test all this?
SpectraCell and like a foundation methylation test off our website at least, so you can tell why you can't absorb these vitamins, and then you'll see your SpectraCell kind of bizarrely. It's not really bizarre when you understand the science, but it matches up with your foundation methylation, with your genetics. So, for example, a lot of people have a folate deficiency on SpectraCell, but they don't have a folate deficiency outside their cells in their blood. Why is that? Well, what's really common here in the U.S. is FOLR2, a FOLR2 error or SNP. SNP means a single nucleotide protease, meaning it's just a screwed up genetic error that's been passed down to you. So you have 3 folate receptors on your cell surface, and they each are coded for by a specific gene. FOLR1, FOLR2, FOLR2, FOLR3. And if you have an error in any of those, but the most common is FOLR2 in the U.S., you won't absorb certain forms of folate. Last week alone, I saw 9 people with homozygous FOLR2 receptor errors or genetic errors. And so they don't have any FOLR2 receptors. That means pretty much half their folate's not going to be absorbed. And it's been that way for them all their life. So half the folate's missing inside their cell. Their hormones are always going to be running low at half mass. It's just kind of, they'll always produce half the amount of progesterone or testosterone or stuff like that, unless you do a workaround with certain forms of the vitamins to work around that genetic error. And that's what we do. That's what I do.
Yep.
Yeah.
That's how we do it.
Mm-hmm.
Can progesterone help with migraines?
Yeah, definitely. It's in the literature. It's all over the place. Definitely. So I usually the most two common causes of migraines I see are low progesterone, so progesterone naturally cools off women's arteries, and they're most sensitive in the brain, also in the pelvis. The question earlier about endometriosis, progesterone cools things off. More progesterone cools things off a lot. In women, they get happy, they get soothed, they get happier the next morning when they wake up after a great night's sleep, stuff like that. The other cause of migraines I see is copper, really high copper through the NCC formula. And so we have to deal with that usually it's a copper metallthionine dysfunction.
Yeah.
And so that's copper, yeah.
And you've talked a lot about those in other videos, so feel free to check out his other videos.
Yeah, copper
it's all there.
metallthionine dysfunction causing a copper toxicity issue.
Yeah. What about PD8020? Would that help with progesterone production?
No, it won't hurt, but it won't help necessarily. PD8020 is a really good product. Most women end up taking too much of it twice a week. Maybe 3 times at most is the highest dose I'd go for most women. If you need PD8020, you're either in menopause or perimenopause or you have vitamin deficiencies. Because your DHEA and pregnenolone production should be fine. If it's not, you got vitamin deficiencies. Or you could have ovarian trauma or adrenal trauma.
Yeah.
So I'm going to cause a storm of comments. I'm not a big fan of adrenal fatigue. That's an odd diagnosis to me. It's not really, to my knowledge, even an official ICD-10 or ICD-9 diagnosis. It's fatigue. It's just fatigue, and your adrenals may not be working correctly, nor your ovaries, nor your thyroid, because you're vitamin deficient. That's usually the cause of what you're calling adrenal fatigue is really just a vitamin deficiency associated fatigue. So
I've seen a couple times on here people are asking about when in life they can take Progestins Plus, premenopause, postmenopause, and then also much earlier in life.
Yeah.
All the time, right?
Yeah. I'll just say yeah. Yeah, ask your upline, ask your downline. They'll tell you. It's the #1 personal care product at Young Living, and there's a lot of women using it every month. Mm-hmm. You'll have no trouble asking about it. You'll get a storm of answers on that. They'll tell you exactly how to. I just got to be really careful what I say and do on Facebook and everything. I don't want to cause any problems.
Yeah. What about those with PCOS? Is progesterone good for them?
Very. Very. But again, what we found is every PCOS patient has bad, significantly bad methylation errors, like their compound heterozygous or their homozygous C677T on the MTHFR issues. And they have big, bad, ugly vitamin deficiencies, which are causing most of their problems. So again, long term, you can deal with the whole problem from that angle, but they need natural progesterone to begin with and lots of it. They tend to really like it. So natural progesterone, if done right, typically causes weight loss or weight normalization. So a lot of women like taking it, not for weight loss, but they just happen to notice that they're losing weight too.
Yeah. This is kind of going along with PCOS. This lady, she has PCOS. She's been taking inositol, Super B, and Progestins Plus, but nothing's been corrected yet. Do you have any suggestions?
I tried Chiral Balance on Amazon. It's a D-chiroinositol. Maybe that's what she's talking about, 600 milligrams.
Yeah.
Try 1 or 2 a day, but watch for hypoglycemia. Try more progesterone and get a SpectraCell. Try and figure out what's going on with your intracellular vitamin levels and environment.
Yeah.
And that'll probably lead to figuring out what your genetic errors are with some genetic testing. I don't know if it's still on sale, but check out 23andMe. They might still be on sale. Don't use your real name. Don't use your real date of birth because privacy is a big issue on that site. But I'd get the medical 23andMe if it's still on sale. And then get a NutraHacker, nutrahacker.com. Get the NutraHacker Complete. It can really help me a lot in figuring things out. So, and if need be, we need to get more specific. We can get a a Pro 7 or foundation methylation. But between all that, I can definitely figure out most of your issues in this realm. That and the Spectracell.
Yeah. What's the best way to determine how much progesterone that you need to take? Testing or just feeling it out?
I think women have to figure that out with dosing it, with trying it, with adjusting their doses in small amounts as they go through it, and seeing how they feel. I mean, if you take too much, you're going to be sleepy. You're going to get a progesterone hangover, which is a way you can say, "Wow, I know I can't take 4 of those. I get a progesterone hangover the next morning. I feel like I want to sleep all day." Yeah, you're taking too much. Maybe instead of 4, you need 3 or even 2.5.
Mm.
And RDTs can be cut up like that. And then if your period comes and it's crazy, you might want to go up to the rule is to double them. So if you're taking 2.5, try 5 when your period hits. If you have horrible PMS or endometriosis. And I have some women who are severe endometriosis cases, so 1 out of 200 women are. So I have 9 of those, which matches with about the 2,000 patients I have. They take 12 to 15 progesterone RDTs a night, and they have severe endometriosis. It means they're missing I think it's their progesterone alpha receptors they never had them. They weren't born with them. So they need a lot of progesterone to force it into their endometrium.
Yeah. That's a lot. But when you need it, huh?
Yeah, and they'll tell you that you'll start them on it. You're going, take 1 at night, and then a few days later I'll call back, check on people, and they'll go, I'm taking 4. I'm like, wow, it's not enough. It's not even close. I'm like, let's just kind of hang there for a while, and then I'll call back a week or 2 later, check on them again, and they'll go, I'm taking 12. I'm like, what? So, and they go, no, it feels really good. I'm finally sleeping, and I don't hurt down there. And I just had a period, and I had to go up to 15 for a few days, but it's really good. And I think 12 is the magic number. I'm like, are you getting a loan at a bank? I mean, this is not cheap.
It's
but
expensive.
But I say, okay, let's adjust the prescription accordingly.
Yeah.
So, yeah.
Does
Because they have severe endometriosis. And they've had a lifetime of surgeries and other horrors where they're young and they don't want to do it anymore.
It's not fun. Does progesterone work for PMDD?
It can help a lot.
What is PMDD?
Google it.
Okay.
Yeah, it can help a lot with PMDD.
What about this lady? She keeps asking about. I can't read. Is that arrhythmia nodosum?
Erythema nodosum.
Is there any alternative for those who have that?
Can you say it again into the mic?
Erythema nodosum. Yeah, I don't. It's probably not the main active in Persistence Plus doing that.
Yeah.
I'm just gonna leave that vague.
That's
Yeah.
fine. What about, is progesterone good for helping? I had this question. Where'd it go? She's been trying to conceive for over 2 years, has PCOS, and she's done multiple rounds of Clomid. What would you suggest?
Foundation methylation, Spectracell, because she doesn't know what she's doing or why. They haven't done enough digging into it.
Yeah.
Clomid's, it's a strange option, and I don't know whether natural progesterone would be an option or not. Probably, but I just have to evaluate the situation more. That's the way I'd probably approach it. Spectracell and get her genetics and see what the heck's going on.
Yeah. Can progesterone affect ADHD?
Yes, in women or girls, not in boys.
Yep. What would it do?
It can help calm them down and help them focus a little better. We heard that over and over and over again. Is it a treatment for it? Not to my knowledge. It's just something that'd probably help.
Yeah. Is RDT progesterone by prescription or OTC?
It's prescription.
Yeah.
Capsules are prescription too.
I just thought this was good. She started with 2 drops on her ankle. After several nights, she woke up really sleepy, backed off, and now she does 1 drop and feels great. So that's an example of someone just kind of trying it as she goes.
Yeah, goofing around with some Persistence Plus or whatever she was using.
Yeah.
Yeah.
Just figure it out. It's kind of fun.
Everyone's so different, huh?
Yep.
Definitely different.
Just going through all these.
You can go faster.
What about if you can't use essential oils because she gets reactions. She loves them, but she doesn't know what to do.
I don't know what to do either.
Okay.
I'm not going to comment on that hair.
Maybe contact
She wants
your
to
office.
email me personally at info@danpursermd.com. Maybe I can help her.
Yeah.
We get a lot of emails there. If I can't help, I'll say I can't help, or maybe you need to set up some time so we can talk about this more. Because I'm really swamped most of the time. But I really, you know what, however many I can help, I'll try and help you every day.
Mm-hmm. Does having ovarian cysts and uterine fibroids mean you need to use progesterone?
That's a really complex question. Usually, fibroids, and some of the literature suggests ovarian cysts are from years of lack of progesterone. But some women will start on RDTs and stuff, and they've had cysts before, and they'll get another one. And I know I've had a couple recently who really blamed the RDTs on developing a cyst. I've actually never seen a correlation there. So
Interesting. This girl, she has horrible PMS. She gets really bloated and super exhausted. Like her stomach is so tender that even riding her lawnmower and hitting bumps just hurts so bad.
I'm just guessing.
Yeah.
I'm not going to make this diagnosis because I haven't examined her, but there's a strong possibility she has endometriosis. That's why it hurts.
Yeah.
And she needs to figure out why she's not making enough progesterone. I know a lot of doctors put them on birth control pills, but I also know the crowd that follows me does not like birth control pills, and I think it's a smart thing because of the breast cancer risk and the clotting and the stroke risk, especially if you have methylation problems, by the way. Or she needs a lot of natural progesterone while someone's trying to figure that out.
Yeah. Couple questions on testing. Do you prefer blood tests or
Yes.
saliva tests?
No.
Blood.
We tried using saliva at USC and elsewhere.
But for hormones, genetics.
No, we're just
Just hormones.
yeah. We're not very. Maybe we didn't know what we're doing. I mean, there was the U.S. Assistant Surgeon General. There's me. There's some really smart PhDs, but we couldn't figure out how to get them to work right.
Yeah. What about
and all the studies? Hang on.
Yeah.
All the studies are based on serum levels. So you're asking me to suddenly compare saliva levels to serum levels? I don't know how to do that.
two different?
Very.
What about like particular time to get tested? Like during your cycle, before, after? Do you have any preference on that?
I know a lot of doctors do. I don't.
Yeah.
I mean, your progesterone level in a young, healthy girl or a healthy woman should be above 10 or 20 nanograms per milliliter anytime we check it. Higher right before you have a period, but
Yeah. What about this lady? Her doctor won't entertain the idea of giving her RDTs, so how can she go about trying to get them?
go to a compounding pharmacy near you. Go to 2 or 3 and ask them who a good doctor is in your area who can help you, who uses their progesterone. And I'll give you the name of probably 2 or 3 doctors or 1 or 2 doctors. And some will be consistent about it because who they really like. And pharmacists deal with these doctors every day. They get prescriptions from them every day. It's so easy to go do that or call that pharmacy and talk to the pharmacist. You can talk to the front staff too, but talk to the pharmacist. And if that doesn't work, contact me.
Cool. This girl, she's 19 and she's only had 2 periods in the last year. She didn't get her first period till she was 17. She thought that was due to her intense ballet training, but now that she's no longer doing that so vigorously, she's still not getting regular periods. Do you know what the cause would be for that?
Vitamin deficiency is the first thing I'd look at.
Gotcha.
I know it's not. You are what you eat. It's. I sound like a naturopath, and indeed you got to honor what they do and how they do it. But as an MD, I would do testing and determine what those vitamin deficiencies are and deal with them. If you're having that many problems and questions before you really get into life, start dating and get married and all that, and start wanting to have kids, then you better figure that out. And Inspector Cell is certainly not an unreasonable test to get up front.
Yeah. What if you get your levels tested, like your progesterone levels, and they're within the regular range? Is it still safe to take progesterone, or?
Well, you know what? I say it every week. I go by your symptoms and your lying eyes because I trust you more than I trust lab work that may have been done incorrectly or drawn at the wrong time or we're making the wrong assumptions about. If you have the symptoms of hot flashes, night sweats, PMS, endometriosis, PCOS, all that, when I was in medical school, they taught us to trust our clinical judgment over and above anything else. I'm going to trust my nose, meaning the way I'm looking at you and listening to you and evaluating you, your history and all that before I trust what the labs tell me. I'm going to trust you more. And it's a common mistake that weaker physicians might make. So that don't trust their clinical judgment skills and their evaluation skills.
Yeah.
I can find you 100 quotes on that alone. So by doctors who are much better, greater than I will ever be.
Yeah, that's deep. Go right back to questions. Will progesterone help rheumatoid arthritis or raging perimenopause?
Perimenopause, yes.
What about arthritis?
I don't know. Not to my knowledge, but I've had women say their aches and pains improve dramatically with it. Especially, there are studies that show that low progesterone causes TMJ. So.
Oh, it definitely has helped with my TMJ so much.
Yeah, your mom's too. I've probably got 300 or 400 patients who it's helped with.
I couldn't even eat food without it hurting, and now I haven't had an issue in years.
Right.
I forget about it.
It's in the literature.
Yeah. Would progesterone help promote natural ovulation? If you're taking natural progesterone?
No. It won't prevent it. Synthetic progesterone will prevent it. So maybe in a sense it's promoting it. But if you're not naturally ovulating, 80% of the time I would have to guesstimate just roughly off what I've seen. It's going to be a vitamin deficiency, or you're in menopause, or you got some ovarian damage.
Yeah. It's interesting.
Can they hear me all right?
Yeah.
Mm-hmm.
What about women who've had hysterectomies? I know you've answered this a couple times, but they're still okay to take progesterone, right?
Yeah. Yes. Having a hysterectomy does not suddenly make you not a woman and not need progesterone for the rest of your body, mind, spirit, everything.
Yeah.
That's I don't know where that came from, but doctors say that to patients all the time. Well, you don't have a uterus, you're postmenopausal, you don't need it anymore, and you're hot flashing 12 times a day, you can't sleep, you're covering your bed in sweat at night. Really? So, yeah. And your PKH for breast cancer hasn't even occurred. That's at 65. And remember that American College of Epidemiology study showed that 500+% decreased risk of breast cancer with a healthy progesterone level. That's huge. PKH for breast cancer is still 65, but now it's a bimodal peak at 35 roughly and 65. 35 we think is from all the young girls taking birth control pills out there.
Interesting.
That's from some Northern European studies.
Yeah.
In my breast cancer patient survival guide, which everyone should grab, and along with my progesterone book, So I've written 3 books that talked about progesterone. Well, 4. My textbook on preventive medicine, my my program 120 book, handbook B for women that talks about progesterone levels and benefits, my progesterone book, which was incredibly popular, and my breast cancer patient survival guide, which was a bestseller also. Matter of fact, other than my textbook, they all 3 of those were big sellers.
Yeah.
Mm-hmm.
I've been number 1 at some point.
What about Dutch testing?
I get asked that all the time. You can do it. I'll look at it, but it's not my favorite.
Yeah. Will progesterone help with the foggy mind or like brain fog after postmenopause?
Yes. Can, not guaranteed. You probably have vitamin deficiency. Usually CoQ10, usually ubiquinol.
What about a 15-year-old with cramps? Can she take progesterone?
Well, yeah, I'd use it all the time with them when the parents want me to.
Yeah.
And we've got you guys.
Yep, I started taking it for that very reason. Probably about that same age, huh? 15?
Yeah.
Yeah.
You know what? They put you on birth control pills at that age, which is unbelievable.
Yeah.
So
That was always the first solution when I was in college. It was a religious college, too. The first thing, anytime a girl came
was
in.
it the Holy Sisters of the Nunnery on the beach surf in Hawaii?
Yes, it was the
Or something.
Nunnery of Hawaii. No, it was BYU Hawaii, and that was the
Whoa.
first solution. Was always to.
Well, with their medical people, they're not with the
Yeah.
school. Yeah.
It was
Don't
always
blame that on the school.
put them on birth control.
I know.
It's sad.
Well, yeah, it's not. It's medically acceptable, but it's not health.
Yeah.
You know my reasons. I'm gonna have to debate that all day long.
It's fun to debate that. Just kidding. Oh, people are really excited to see CoQ10 for brain fog. That's good.
Yeah, try ubiquinol. Get the red label Qunol, if nothing else. You know, Walmart, Costco, or anywhere. It's got to be ubiquinol, and you got to take the first day if you want to know that's causing your brain fog. Take 5.
Yeah.
Yeah. So when you go to Walmart or Costco, take a water bottle, leave it in your car, bring the Qunol back, open it up, take 5, and probably by the time you get home and get the groceries out of the car, you'll know if it worked or not.
Yeah. This lady had a complete hysterectomy at the age of 27. She's wondering if she takes progesterone, should she also take like estrogen with it?
Well, we know so little about her.
Yeah.
How old is she now? How long has she been off? Probably yes. The medical literature would suggest yes. But the mode she would take them in are going to be different.
I know you answered this earlier, but what specific labs should people go asking for progesterone? It's
If
good.
you really need them and feel like you need them, absolutely. Serum progesterone level, serum estradiol level, serum free and total testosterone level, a serum DHEA SO4, and this is how we check thyroid properly, a TSH, an FT3, that's also called a free, as in I'm free, free T3 or a free T4. Free as in Frank, I guess is what I should say.
Yeah.
That's your proper thyroid valve. Get those to start.
Okay, this is kind of two opposite ways this question goes. But this lady, she started taking progesterone and her period went away. Is that okay? Or is that...
Well, yeah, she's 48 or 49. She probably likes that. Doesn't mean she's totally menopause, but she's close. We know so little about her. If she's 20 and went away, that's a little much, but...
Yeah.
Or 30. Sorry, my throat's getting dry.
And then could taking progesterone help regulate your periods if you're a person who they kind of come and go? Or like you said, is that a vitamin deficiency maybe? Mix?
Yeah, something else is going on. So the question I've got for them, do birth control pills help regulate your period?
This girl, she said she was taking birth control pills, but she didn't like how she felt on them.
Right. Most young living distributors won't, or most people following won't because of the methylation problems. Can't break those things down correctly. That's why you don't feel good on them, or they make you feel crazy. You didn't answer my question, though. Do birth control pills regulate your period?
No, they don't. Don't they just make you bleed?
Right, they just cause you to hemorrhage once a month. It has nothing to do with your period. You're not cycling. You're not doing anything. It's just a withdrawal hemorrhage once a month. It's completely bogus and completely erroneous and incorrect and completely ignorant when doctors tell you that it's going to regulate your period. A birth control pill will regulate it. It does not. It does not. Would someone please explain to me how it regulates your period? It does not do it. It just shuts you down and then lets you hemorrhage once a month because they thought that'd make you feel normal. That's why the newer birth control pills you take 6 months at a time without the hemorrhaging. And they let you hemorrhage once every 6 months just to clean things out a little.
So crazy.
It's just bogus.
That's terrifying.
And most doctors believe that stuff. It's just, wow. Most doctors don't, from what I can tell. I better shut up. I'm just going to be quiet. I just have spoken to so many doctors out there who don't know this stuff. That's why I get to speak at Disney World all the time. Disney World.
Is that why you're wearing that shirt?
Yes. I'm hoping, call me Disney World, call me.
This girl, a week before her period starts, her entire body, bones, muscles hurt. And when she's touched, it causes extreme pain. Is that due to progesterone? She said at one point she was put on progesterone for a week and she felt so normal she could cry.
Yeah, due to lack of progesterone. So normally a woman right before her period should put out from her ovaries a big surge of progesterone. That's to kind of help her through her cycle and everything, her period, and minimize the bleeding and stuff like that. Some women don't create much of a surge. Some women don't have any surge because they're not making any progesterone for whatever reason. It could be genetics. It could be damaged ovaries. It could be a vitamin deficiency. It's got to be, someone's got to figure it out or should. And if that woman feels better, there's her lying eyes saying, I love the way I felt on that progesterone. Why didn't they continue the progesterone?
Don't know.
Yeah, she doesn't say. I'd be like, what cruel doctor would pull that progesterone from you? It's harmless, it has no real side effects, and it made you feel normal, and they took it. It befuddles me as to why that's going on.
Yeah.
I think, so it fits the Hippocratic Oath. You're doing no harm with progesterone, none. And I wish someone would show me an article that shows harm. If it's in there, it's a mistake. The article's written poorly. I've seen 3 or 4 of those over the years. They conflate the word progesterone with the word progestational agent, or the terminology progestation or progestin, which are synthetic-made progestational agents or synthetic progesterones that don't work and are just bad, cause inflammation of breast cancer and clots. So, yeah, why would they do that? Sorry, I'm ranting. Sorry, I'll shut up.
That's okay. That's interesting stuff. What about if you're past the 10-year window? Can you still take progesterone?
Wow. Who wrote that question?
Do you want me to say her name?
Yeah.
Donna Caton.
Donna, you're the bomb for asking that. How do you know about a 10-year window? So, yeah, she must have read my book, or she's a professional or a doctor or something, researcher. 10-year window, no. So her question is not completely apropos. 10-year window refers to the estradiol. So a woman who goes through menopause, whether it be surgical or natural, if she doesn't take any oral estradiol for 10 years after that event, after either her last period or her last, or her ovaries were removed, surgical menopause occurred. It's got to be ovaries removal. It can't just be a partial hysterectomy where their uterus or endometrium were removed. But and they go 10 years, they can never be put on oral progesterone because it gives a high risk of clots, strokes, heart attacks, all that. That's from the Nurses Health Initiative. But if any time during that 10-year period of time they're put on oral estrogen, whether it even be Premarin, which is horse equine estrogen, but there's still some 17-beta estradiol in there, or any other natural form of 17-beta estradiol, that resets the clock to another 10 years. So as long as they keep taking them, the clock's gone. The minute they stop, the 10-year window starts again, counting down. And if they get to 8 or 9 or 10, somewhere in there, I won't put them on the oral estradiol. It has nothing to do with progesterone. Strictly about estradiol. But it's the estradiol 10-year window. We know it from the Nurses Health Initiative and the Women's Study and all that. Really smart doctors put all that together. That's why you saw heart attacks and strokes in those studies. Not from progesterone, but from estradiol. Premarin that was being given inappropriately. They just didn't know it during that study. Is that too much?
No, it's good. Should we start wrapping up, though? It's 8:11.
Did they like it?
Yeah.
There's always more questions
I don't
coming
see
in.
any
You can
floating
answer.
hearts coming up. No,
There's one,
there's
2, 3,
what?
4,
Okay.
5, 6. He loves those floating hearts.
Floating hearts everywhere. Oh, I used to not know what those meant, but yeah. So next week you're gonna be here, right?
I'm here this next week, but not the next.
So let's do one. I don't know what we're gonna do now. Give me some ideas. Post some ideas. Brecken, who's our winner tonight for the 30-minute visit with me?
Oh.
I think that Donna who asked the 10-year window, that's a good question.
Donna?
Donna.
Let me find
Donna
her
Caton,
comment.
I think was her name.
Goodness.
Donna Caton.
Caton, yeah. Donna.
Yeah, that was a great question. How did you know about the 10-year
Got me
window? You read
fired
one of my
Got him
books, haven't you?
excited, yeah.
'Cause I talk about it in some of my
Didn't
books.
stump him.
My estradiol book. So get my estradiol estrogen book, menopause book. I don't know what it's
Yeah.
called.
All your books are at greatmedebooks.com.
I forgot. Yeah,
Uh-huh.
I
We
came
still
up
have
with
that.
didn't I? So at medebooks.com. Greatmedebooks.com. Is it www before that?
Yeah, it's.
Why don't we have to put that in anymore? You said to put that in.
We're sophisticated now and we don't need it.
Okay, www.greatmedebooks.com.
Redundancies.
Sorry. World Wide Web.
Uh-huh. I bet your youngest daughter wouldn't even know what that means.
Probably not.
Probably not.
She knows what progesterone's for, though.
Yeah, that's true.
But yeah.
A couple things to help remind people. We still have this sale going on for if you buy a genetic test and a SpectraCell, you get a free 30 minutes too. So not only Donna gets that free 30 minutes, other people will get that too.
And so many of you have bought testing, and we're still waiting on receiving it back from you guys. So make sure if you purchase it that you do it.
Yeah, do it and get it back to us.
Because you can have consults.
Well,
with
don't
me.
get it back to us. Get it
The
to
lab.
either GX Science down in Austin, my friends at GX.
Mm-hmm.
And don't forget, we do offer dementia testing.
Mm-hmm.
If you're kind of stressed in the back of your mind about dementia because your granddad had it or your mom is kind of acting a little funky.
Like you. I'm joking.
Make sure you do that testing. It's cheap. It'll give you answers, and you can sleep better at night. Or there's some really, really good options in the literature now. Watch my PowerPoint. Watch my video on that, and you'll see the options.
On dementia?
Yeah.
Yep, it's pinned to the top of your page on Dan Purser MD on Facebook.
How'd you do that?
You just pin it. That's
I
all
don't know
you
how to
do.
pin stuff.
Yeah.
You don't know how to pin
I
stuff.
don't know.
Or it's right on the front page of danpursermd.com
I'm so
too.
busy just trying to keep my head above water every day with patients.
Mm-hmm.
Okay, so shall we call it quits? Oh, Donna Kate won it?
Yeah, I just said, Donna Caton, you won. Please email me. And they put my email. So I'll DM her too, but just wanted to put her name out there.
Yeah, so, and so post something about what should we talk about next Sunday.
Oh, you've already gotten a lot, but I'll put a dedicated
good.
post
Couple
to it
good.
too. And
Thank
keep
you.
asking your questions here. We'll keep trying to get through them throughout this week. And
Yeah, I'll keep on them too.
he likes to do it when he's bored and lonely.
Well, I'm never
I'm
lonely.
just kidding. Can't
I
be
wake
bored.
up at 4 o'clock in the morning. I'll sit there for 3 hours.
Oh, I
Okay.
know. I get the
He
emails.
sends us emails.
So let's see. I'd like to thank y'all for listening. I'm trying to learn all this, so I do the same thing every week. We're all family now and have been for a while. You know how I feel. I mean, I'm going to listen to you and your symptoms and your lying eyes, so to speak. What do you believe, your lying eyes or what some schmucky doctor tells you? I probably believe your lying eyes usually, but and I really appreciate that. So I hope you do too. I really try to cover topics you like. You can watch this Facebook Live on my YouTube channel, and please like those if you do, or even if you don't. You can listen to these podcasts too, Spotify and iTunes.
Mm-hmm.
And if you've got ever got one of my books, go back and leave me a review. I really appreciate it. So this is Dr. Dan Purser signing off. God bless and go in good health.